Turn to 5 on your health tonight, and today marks 1 year since the largest measles outbreak in the U.S. in decades. It started not here in Massachusetts, but in West Texas. Over the last 365 days, more than 2,200 measles cases were confirmed in all places across the country, putting the United States at risk of losing its measles elimination status. So here to answer your questions and talk about it is a familiar face, Dr. Todd Ellern from South Shore Health. So great to see you, Doctor, as always. So, and as you know, the U.S. typically sees, what, a few dozen cases of measles in a year? But by comparison, last year's number was off the charts. So do you think we're finally past peak? Here we are, what, late January?
Listen, again, last year, more cases than we've seen in 35 years. And this year in January, there's been close to 170 cases. We are not starting off well.
Not starting off well. So I want to put a map on the screen, and I want you to dissect it for me. We'll walk through it. Let's take a look at this map of the United States, and you see shades of blue, right? And every one of those states, 45 in total, had at least one measles case last year, but not, if you notice, not Massachusetts, not Maine, not New Hampshire. Is that luck, or are we doing something right?
It's absolutely not luck. Look, what it is virus versus vaccine. What do I mean? We're dealing with the measles is the most contagious virus in a susceptible population, and the measles vaccine is one of our best vaccines. So what happens is if you're vaccinated, generally speaking, measles versus vaccine wins. But if you're unvaccinated, measles can spread. If I have measles, I could literally spread it to 12 to 18 people. So it's the perfect litmus test to figure out how we're doing with our vaccination.
So if the U.S. does lose that elimination status for measles, how hard is it to get it back?
Well, it's going to be difficult, and one of the reasons is because overall our vaccination rate in the U.S. is declining. And what am I saying? When you look at kindergartners that are being vaccinated, more and more parents are choosing not to vaccinate the kids for one reason or another. Sometimes it's medical, but often it's religious or non-medical. We're seeing that go up. So we are having we're seeing a more susceptible population. And there are pockets, even in Massachusetts, and we're doing better than most states, but there's still pockets in Massachusetts where we're seeing significant decreases. So it's a real problem. The other thing, Eddie, is we're really a victim of our success, because many of us have not ever seen measles. So if you're a parent, you could be like, well, measles, it's something of the past. I don't have to worry. I don't have to vaccinate. It kind of makes sense, but it's really going to bring us backwards in time.
Measles was part of the conversation when I was a young boy, and I wouldn't think these years later it would still be part of the conversation.
And it's true. Now remember something. We in the U.S. we're doing better than our neighbors, Canada, Mexico, Europe. But remember, this virus does not respect or recognize international borders. It's a problem.
Dr. Ellern, great to see you.
Good to see you.
Thanks for the information, Shane.